Hello everyone, my name is Derek Forrest. My major is Allied Health. The name of this class is Communication Studies. My topic for this speech is going to be diabetes mellitus. My purpose for choosing this topic to speak on is because diabetes mellitus is a disease that affects millions of Americans across the United States. There are also many risks and complications associated with diabetes mellitus. These risks and complications only occur when diabetes is not properly managed or treated. I also have members of my family who have been diagnosed with and live with diabetes mellitus today. There are two types of diabetes. The first type is diabetes insipidus, and the second type is diabetes mellitus. They are easily confused. A brief definition of diabetes insipidus is diabetes insipidus is a problem with ADH, known as antidiuretic hormone, also known as vasopressin. In diabetes insipidus, glucose levels are normal. The diabetes mellitus that we're talking about today, glucose levels are not normal. Diabetes mellitus is defined as hyperglycemia that results in the body's inability to use glucose effectively. Insulin is a hormone that is created by the beta cells of the pancreas. Insulin's job is to help the body use glucose the way that it should be, for energy. There are four types of diabetes. Four types of diabetes are type 1 diabetes, type 2 diabetes, pre-diabetes, and gestational diabetes. Type 1 diabetes is defined as when the body attacks the beta cells of the pancreas, which causes the pancreas inability to produce insulin, or there is little insulin produced. Type 1 diabetes usually occurs and is only diagnosed in young adults. It is possible for older adults to have type 1 diabetes as well. Type 2 diabetes is defined as lack of or inability of the body to use the insulin that is produced effectively to turn glucose into energy. Type 2 diabetes is usually diagnosed in middle-aged and older adults. Pre-diabetes is defined as when the levels of glucose in the blood are high, higher than normal, but not high enough to be considered diabetes. Many people who have pre-diabetes will eventually develop type 2 diabetes, especially if it's not treated or managed, or if it's not picked up in time by a physician. Gestational diabetes occurs in pregnant women only. Now, because a woman has gestational diabetes does not mean that she had diabetes before she was pregnant, and it does not mean that she will have diabetes after she is pregnant. Having gestational diabetes does raise the risk for developing type 2 diabetes later on in life. Some statistics that are on the American Diabetes Association website that I found discuss the American population as a whole in regards to diabetes. 25.8 million of all Americans, which is also 8.3% of the American population, have diabetes. Out of that 25.8 million, only 18.8 have been diagnosed. The other 7 million are undiagnosed cases. 79 million people are pre-diabetic, which is way more than half diabetes that has been diagnosed. So those people are on the verge of developing diabetes if they don't get the proper management and treatment that they need. Roughly 10% of all men and 10% of all women have diabetes out of all Americans. Roughly 34% of the American population who has diabetes is either black or Hispanic. There are many risks and complications associated with diabetes, and statistics show that the risk for heart disease and the risk for stroke is 2 to 4 times higher in individuals who have diabetes than individuals who do not. The leading cause of new blindness and of kidney failure is diabetes. 60 to 70% of all individuals who have diabetes will have some form of mild to severe nervous system damage. More than 60% of the non-traumatic lower limb amputations performed by hospitals are done on people who have diabetes. Just want to give a brief review of what I spoke about. There are two types of diabetes. The first one is diabetes insipidus, the second is diabetes mellitus. Diabetes mellitus can be broken up into 4 different types. You have type 1 diabetes, type 2 diabetes, pre-diabetes, and gestational diabetes. Type 1 diabetes usually occurs in young adults. Type 2 usually occurs in older adults. Gestational is only in pregnant women. And pre-diabetes occurs in 79 million Americans, which can develop into type 2 diabetes if not treated or managed. The 25.8 million people who have diabetes, only 18.8 million adults know that they have it. There are many risks that can occur from diabetes that need to be taken care of. So the American Diabetes Association recommends that you see a local physician or community outreach center. You can also obtain more information from the American Diabetes website, which is www.diabetes.org. And I would like to thank you all for your time and listening to my speech on diabetes. Thank you.